Thank you for joining Leo today for this webinar, Best Practices for Evaluation, Insights from the Stay the Course Study. My name is Andrea Ringer. I am a research associate at Leo, the Wilson Sheehan Lab for Economic Opportunities at the University of Notre Dame. I'm happy to be hosting the webinar today. Leo is a nonpartisan research center established in 2012. We partner with nonprofit and government agencies across the country to generate reliable, scientific evidence about the impact of programs designed to reduce poverty and improve lives. Our areas of interest include housing, health, criminal justice, education, child welfare, and self-sufficiency. Once we have generated reliable evidence, we work with partners to share this information with a wide range of policymakers and practitioners to drive policy, program, and funding decisions, and in turn, improve lives. A few quick housekeeping notes for this webinar. The webinar is 1 hour. The presentation will be approximately 35 minutes, with 15 to 20 minutes for Q&A. You should feel free to ask questions using the Q&A button at the top of the screen throughout the webinar. We will get to as many questions as possible. Finally, we will post a recording of the webinar and the slides on Leo's website at leo.nd.edu. We will send an email with details following the webinar. With that, let me introduce the presenters on today's webinar, Jim Sullivan and Corinne Weaver. Jim Sullivan is the co-founder of Leo and a professor of economics here at Notre Dame. He is a co-principal investigator on the evaluation of Stay the Course. Jim is an alum of Notre Dame and received his PhD in economics from Northwestern University. Corinne Weaver is the Director of Research and Evaluation at Catholic Charities Fort Worth, where she oversees the research and evaluation work of the agency. Corinne spent her early career providing psychological counseling and assessment services within the public school, juvenile justice, and child welfare systems. Driven by a desire to better understand the efficacy of psychological interventions, Corinne transitioned into roles supporting several research and evaluation projects, and found her true calling helping Catholic Charities Fort Worth apply research insights into actionable improvements in service delivery for families in need. Corinne holds a BS in psychology from the University of Georgia and an MA in psychology from the Chicago School of Professional Psychology. In today's Leo webinar, Jim and Corinne will share findings from the Leo evaluation of Stay the Course, a community college mentoring program run by Catholic Charities Fort Worth. They will also describe key insights from the process of partnering with Leo to conduct an impact evaluation, including how to integrate evaluation into program operations, how to handle challenges with randomization, how to monitor implementation to maximize impact, and how to share evaluation results with key stakeholders. With that, I would like to turn this over to Corinne to begin the presentation on best practices for evaluation.
Thank you, Andrea. The Stay the Course program is an intervention designed to promote persistence and degree completion among low-income community college students. And we do this by addressing the personal, non-academic, social, and institutional barriers that prevent students from succeeding. Stay the Course has two primary components to the intervention. The first is intensive case management, and the second is emergency financial assistance. I'll talk about each of those components in a little bit more detail, but first I wanted to give you some background to why we designed Stay the Course in the first place. The first reason is that we know the annual tuition for community college is on average 64% less than the tuition cost of in-state public four-year universities. Therefore, community colleges offer low-income students a cost-effective way to achieve higher levels of education and prepare for the demands of the labor market. We also know that the earnings of individuals with associate's degrees is on average over $9,000 more per year than the earnings of individuals with a high school degree. Finally, we know that the unemployment rate for adults aged 25 to 40 with an associate's degree is on average 42% less than the unemployment rates of adults with a high school degree. However, despite the lower costs and higher returns of community college persistence, We know that there is a completion crisis in American community colleges. Specifically, as you can see here, 6 years after initially enrolling in community college, 39.1% of community college students had earned either a 2 or a 4-year degree. However, 60.8% had not earned a degree at all. And this completion crisis is particularly high among minority populations and those from disadvantaged backgrounds. Further, not completing a degree can be financially crippling for a community college student because they often incur debt, but do not actually obtain a degree that can help them increase their wages. So at Catholic Charities Fort Worth, and in partnership with Leo, when we learned this information, we decided to take a deeper dive into what some of the barriers are to graduation, particularly for low-income students. And that process really revealed 4 main barriers to college graduation. The first 2 being college costs and academic under-preparation were areas that we felt the community college and other academic institutions were better able to address. But as a nonprofit social service provider, we felt highly equipped to address the other 2 areas that we discovered, which were institutional obstacles and personal non-academic obstacles. So when we say institutional obstacles, we're really talking about the complexity of navigating the college system. So particularly as colleges receive declining state appropriations and they have rising enrollment costs, the ratio of students to resources starts to really get to a place of disadvantaging the student. So, you know, they might go see an advisor or a counselor, but be one of hundreds, if not thousands, of students that are assigned to that particular staff member. And so we designed Stay the Course to really be able to have low caseloads so that our navigators, is what we call our case managers, our navigators are really able to work with students in a more intimate way and to really help them to navigate all of the sort of challenges and obstacles that are a part of the college system. The other area that Stay the Course is designed to address is the personal and non-academic obstacles that often get in the way of college persistence and completion. And we like to think of this as basically life and life that happens outside of the classroom. And so many of our students that we serve are older and more financially independent, and so they often have to balance work and school at the same time. Further, they often have troubles identifying and maintaining quality childcare for their children, or they're often having troubles with reliable transportation. The area that we're in, Catholic Charities Fort Worth in Texas, is not known for its public transportation systems, and so our students are often struggling with how to get to class on time. And then further, they often experience these unanticipated financial shocks throughout the year due to, you know, potentially a car breaking down, or, you know, in the summer when it's really hot here, they have an air conditioning bill that is out of control and could potentially get in the way of their ability to make a tuition payment. And so Stay the Course is really designed to help with all of these types of obstacles that students face. So Stay the Course, as I mentioned, is predominantly based on 2 primary components, the first being intensive case management and the second being emergency financial assistance. And those components were built with the principles of being strengths-based, customizable, holistic, and long-term. And so what we mean here is that while we are available to help students overcome barriers, we also really spend a lot of time with them identifying what their strengths are, what they're good at, and we do this as an intentional beginning to every semester that we meet with our students to really help identify, you know, what they bring to the table and how we can use their innate strengths to help address some of the barriers they're facing. When we say that our services are customizable, the best example I have of this is that, you know, we believe it's important to see our students face to face and to do that on a regular basis. But we also know that their schedules can be chaotic. They sometimes start at one of the local community college campuses and they might move and take classes at others. And so our goal is for our navigators to be as mobile as possible. They are housed at the community college campus, but they also travel to meet students either at their homes or at a kind of third-party location, or sometimes they'll be meeting them in between classes to grab a cup of coffee or to sit with them while they're eating their lunch, and try to be as mobile and flexible as possible to really meet the students where they're at. We also have long-term services. So specifically, the program doesn't technically have an expiration date. So we had originally planned to serve students for about 3 years, but we did have a handful of students who were making great progress towards their degree, but hadn't quite crossed the graduation stage at the 3-year mark. And so, we had invested in them for so long that we continued to invest in them for their last semester or two. And overall, we do have very high retention rates to promote that long-term nature of the program. Specifically, in our second cohort, we saw that 75% of students had either completed the program or were still enrolled 1 year after enrollment, and 59% had either completed the program or were still enrolled after 2 years. Additionally, we pay a lot of attention to the cadence of our services, and what I mean there is that we believe regular, intentional interaction between the students and navigators is key to the success of Stay the Course. So we aim to engage with our students on a weekly basis, and that doesn't have to be a very lengthy interaction. It could be as simple as a text message conversation to check in on the student and see how an exam went, or whether or not they were able to prep for a particular course as they wanted to. But that frequent contact is really important. We also aim for 2 face-to-face meetings per month. And again, we already talked about that as being as flexible as possible, but we really believe that frequent interaction can really strengthen the relationship between the student and navigator, and it presents a situation where the student isn't sort of waiting for a problem to arise before they're addressing it with their navigator, but they're much more likely to be prompted to share something that might be a problem kind of before it emerges. And then we also aim for our students to complete 1 action step, which is a component of their service plan, every 3 weeks. And our navigators are trained to really help students break their service plans down into small actionable steps so that they can feel that sense of continuous movement towards their goals. Last, as I mentioned, Stay the Course has emergency financial assistance available to students. Specifically, they have access to $1,500 over the life of the program, but cannot draw down more than $500 per semester, and that's in order to help the funds sort of stretch. And those funds are available for non-academic emergency needs. So this would be the example I gave of your car breaking down and you have no way to get to class and you need a car repair, or potentially a very high electric bill, or a problem with a childcare provider and needing to switch providers. These are the types of things that our students are often coming to their navigators with, and they're able to access these funds in order to kind of smooth their financial situation out so they can continue to focus on school and not have to make a sacrifice of their academics in order to take care of life outside of the classroom. So in a little bit, you're going to hear Jim talk to you about some of the results that we've seen as a part of participating in an impact evaluation with Leo over the past several years. But before he does that, I wanted to talk a little bit about what it's been like for us as a nonprofit social service provider to integrate rigorous research into the work that we do. And the first consideration that I would suggest anybody considering this type of work take is this idea that by participating in rigorous research, you often have to limit the types of midstream program modifications that you're making. The reason for this is that rigorous research requires a somewhat stable intervention so that you're assessing the same thing from start to finish. However, I know from experience that what we plan in a boardroom, what we plan in a conference room, and then what we kind of put to paper for a program plan often takes a very different shape once we're actually working with students and we're out in the community and we're doing things live. And so the lesson that we've learned internally is to really take your time in developing an intervention that you're planning to pair with rigorous research. Test out components of it when you can, get in front of your population of interest and make sure that they're giving feedback on the intervention before you're going live. But also kind of once you've launched a program that is being evaluated, having really clear communication between the service providers and the research partners to ensure that when changes are made to the intervention, all kind of considerations have been taken into account and that all parties are kind of on the same page about when modifications are needed. And of course, if those modifications are in the best interest of the students or the program itself, we'll often make them. We just take a little bit more caution and care in the way that we make those decisions. Additionally, we've paid a lot of attention over the years to our data collection infrastructure and our ability to share that data in a confidential way. And so that's really for us has been about being really mindful that the data collection we're doing aligns with the goals of the program, and that we have secure sort of file sharing mechanisms and we've really thought carefully about how to properly de-identify our data before we get into sharing that with the research partners or our community college partners, and just doing so in an ethical way that really respects our students. We've also learned the importance of both leadership and staff commitment to the process of participating in impact evaluations. And the way we've done that is to really just promote sort of this is a shared learning opportunity, and to be as transparent as possible about what we're learning throughout our journey. We've learned that by taking extra steps to make sure that our board and our leadership team are bought in to participating in impact evaluations, we're able to really take the extra steps needed to ensure a quality intervention, and we don't feel forced to cut any corners. And from the staff perspective, we've learned that when they feel really comfortable and confident in understanding the reasons for and the results of an evaluation, they have less anxiety about producing results, and they're much more focused on learning from everything they can and constantly improving. Similarly, we've learned that our fundraising, when we go out and do fundraising, that our funders are really interested in this idea of shared learning. And so we often try to take them on this journey with us of helping us to shape the program, helping us to, when we learn, you know, what are the outcomes, what are the areas where we're not seeing outcomes, we invite our stakeholders into the conversation so they can be a part of that shared learning process. And that tends to kind of reduce any anxiety that anybody has about, you know, potentially what it means to kind of have this rigorous impact evaluation involved in the work. And the last lesson we've learned here is that a well thought out recruitment plan can really save you a lot of hassle later on. And so we're, with Stay the Course and with some of our other case management programs, we're embarking on long-term journeys with students and other clients. And we know that by clearly articulating what the intervention is up front and making that initial entry into the program really robust and clean and clear for the participants, they're much more likely to stick around for the long term. And it's with that long-term interaction that we're actually able to get the outcomes we're looking for. And so we've learned over time to really not minimize the importance of what that recruitment and enrollment process looks like, and to spend, you know, almost as much time on that as we are on designing the full intervention, because it really sets the students and the navigators up for a great relationship. A couple of other points to talk through. The first being the idea of random assignments. And Jim will talk about this a little bit more later as well when he talks about the way that the Stay the Course study was designed. But quickly, we basically had a group of students who were randomly assigned to receive the Stay the Course program services, and another group of students who were randomly assigned to receive services as usual at the community college. The reason for this is that it helps us to really learn what truly would have happened in the absence of the intervention, so we can measure true impact. While this is something that is really, you know, beneficial from the perspective of building rigorous evidence and knowing where to allocate our scarce resources, really being able to put those resources into things that are proven and we know work. In the short term, and sometimes for the social service providers that work at Catholic Charities Fort Worth, there can be a little bit of a challenge with balancing their natural state of empathy and wanting to support all clients with the kind of rigorous demands of random assignments. And so we have to just work hard on sort of a management lens here to make sure that our navigators really understand the rationale for this, and that they're able to kind of keep their emotional investment in the participants sort of in check in relation to this kind of broader goal that we're working to achieve. And so you'll see this quote here is really just from me. It's something I often say to our staff, is that sometimes you have to say no in the short time to a participant, but by doing so, you're helping to prove the efficacy of our services, and therefore making a case to expand and serve more clients later. And at the end of the day, we only have as many spots in the program as we have. We're going to have to turn some students away. And so we believe by following a random lottery procedure to do that, we're actually in many ways being more fair to the students that we serve than if we were to take a different approach. And then the last thing I'll talk about before passing it over to Jim is just this idea of how important it is to monitor implementation to maximize impact. So we believe strongly that without proper implementation of a program, there's no way we can expect to see the desired results. And so at Catholic Charities Fort Worth, we took two kind of important steps to make sure that we were implementing Stay the Course appropriately. The first is that we established a set of minimum expectations on service delivery, and then we also established an optimal goal. So obviously the goal is what we want to see, but the minimum expectation means if we see anything below this, we know we have a red flag that we need to address. And some of those two-person meetings and the weekly contacts fall into this service metric area for us. The second thing we did was then we took those metrics and we built them into our Salesforce database so that our staff had access to on-demand dashboards and reports and scorecards to be able to see this information. How are they stacking up against these metrics, both at a program level, but also at an individual navigator level on a daily, weekly, monthly basis. It's a bit of a cliche, but it's the idea here that what gets measured is what gets done. And so we felt it was really important to make sure that all of our team members had easy access to understand how robustly the intervention was being implemented, because our belief is by paying attention there, that's sort of the leading indicator that can then promote the strong outcomes that we hope to see. And with that in mind, I'll pass it over to Jim so he can talk to you about what some of those outcomes have been to date.
Thank you, Corinne. And thanks to all of you for joining in on this webinar. It's been about 5 years now since we launched this impact evaluation of this really exciting and innovative program. And so I'm delighted to have this opportunity to share with you real results and really the impact these results are having on the growth of this program. So I'm going to lay out first the design of the experiment that we ran to measure the impact of Stay the Course, and then I'll share with you the results of that study. And so let me start by telling you a little bit about how that program was laid out. So back in the fall of 2013, we enrolled our initial cohort of students into the Stay the Course study. And the way that we did this is that we first, working with Catholic Charities Fort Worth, identified the eligibility criteria. What kinds of students did they want to enroll in this program? So these were low-income students identified as Pell eligible at the community college. These were students who were initially enrolling full-time status, and it had a minimum GPA requirement of 2.0. And what we did is share these requirements with the community college, and they gave us a list of students who satisfied all those criteria. And in the end, that list was upwards of 1,100 students at the Trinity River campus at Tarrant County College in Fort Worth, Texas. And then we at Leo randomized that list of students. Catholic Charities Fort Worth would not be able to serve all of these students, and so we gave them a shorter list of students that they would recruit to be in the program. And that shorter list was selected randomly, and so we had a group of students who were invited to participate in the program, and then a group of students who could not get access to the program because there was not capacity. And the experiment is simply following key outcomes over time for those two groups: the treatment group that was invited to participate and the control group that did not have that opportunity. And the initial enrollment into the program for the first cohorts of students occurred in the fall of 2013, and we have been following them up over time and giving periodic updates, sharing results with Catholic Charities Fort Worth. And we're now have data on key outcomes for up to 4 years after that initial enrollment. And the key outcomes that we're looking at are, first, are they still actively enrolled? And that means enrolled at any college. It could be at Tarrant County College, it could be at another community college they transferred, or it could be at a four-year college. And we get those data through Tarrant County College, who has those data from the National Student Clearinghouse. So we're not relying just on the data from the community college itself, but they have access to data that includes enrollment and degree completion information for all students in virtually any college across the country. So whether or not they're actively enrolled will be one outcome, and then whether or not they've obtained a degree will be another outcome that we will have examined. And I'm going to focus on the results for this fall 2013 cohort. In particular, I'm going to share results for you for 3 years after enrollment in the program. That's 150% of the standard time if you went full-time throughout to get your associate's degree. So I'll share, most of the results will be for 6 semesters after enrollment, but I'll also share some more recent results that are looking at these outcomes 8 semesters after, so at the four-year follow-up. So that's the general structure design of the experiment. We had 2 control groups, 2 groups of students well, I should say 2 treatment groups of students that were served through this study. So one group of students received the full package of services that Corinne described. So they were enrolled in the Stay the Course program. There was another subset of students that, from our list of eligible students, that were invited not to the Stay the Course program, but to receive just emergency financial assistance. And so you could think of this as a second treatment group that got just a subset of services available in Stay the Course. And we wanted to examine what is the impact of just having emergency financial assistance for a number of reasons. One is that the case management services that are available in Stay the Course can be expensive. Can we get the same outcomes by just providing financial assistance? And the other is that one of the fastest growing interventions to address issues outside of the college setting at community college campuses all across the country is providing emergency financial assistance. So we wanted some information on what is the impact of programs that provide that kind of assistance. And so I'll show you some results comparing those who receive emergency financial assistance to those in the control group who don't receive either of those services. So that's the structure of the experiment. Let me show you what we find after 6 semesters. So when you look after 6 semesters, this is the fall 2013 cohort, the outcome, the graph on the left shows you whether or not the students are still enrolled in any college 6 semesters later. And so what you see is amongst the Stay the Course participants, nearly half are still enrolled in a community college or 4-year college 6 semesters after enrollment in the program. Is that a high rate or a low rate? The only really way to know that is to compare it to a group of people who didn't receive the services, so the control group or comparison group. And what we see is the group that was not invited to participate in Stay the Course at all were still enrolled at about 24%. That difference between the treatment and control suggests a doubling of enrollment rates when you compare the treatment group to the control group. So in other words, the Stay the Course program has led to a doubling of enrollment rates over 6 semesters. Ultimately, we don't want them to stay in school forever. The goal of the program is to generate degree completion. So we looked at what fraction of the treatment group and control group have completed a degree 6 semesters after initial enrollment. And what you see is a substantially larger fraction of the Stay the Course participants have obtained a degree as compared to the relevant treatment group, or relevant control group. Now, a natural question here is, are there certain groups that benefit more from Stay the Course than other groups? And so we looked across a number of different domains. We looked by gender, by race, by initial credit hours, by the number of entry examinations that they had passed. And when we looked across those groups, one particular subgroup stood out more than any of the others. And that was the effect of Stay the Course for females. So what you see here are the results for females in the fall 2013 cohort, where you see that they, like the overall group, have about amongst the Stay the Course participants, have about half of them are still enrolled in school. but compared to the relevant comparison group, this is a much larger effect. So their females that participate in Stay the Course are 36 percentage points more likely to still be enrolled in school 6 semesters after enrollment in the program than the comparison group. So that's really a very large and, as we say in kind of the impact evaluation world, a statistically significant effect of this program for females. If again, ultimately what we care about is whether or not they graduate, and we're seeing this very large pronounced effect for females 6 semesters after being enrolled in the program. And so this is about as solid evidence as one could hope for on the impact of a program. We're finding for females here, this is a large effect, and as I'll show you shortly, a persistent effect. So I mentioned earlier that we enrolled 2 different treatment groups. All the results I've just showed you are for students who have participated in the full Stay the Course program as compared to a group that doesn't receive any additional services beyond the status quo that the community college offers. What I want to share with you now are how do the results look when we compare those who were offered just emergency financial assistance as compared to students who didn't receive any additional services. And so these are the main results for that. So on the left you see the blue or the purplish bar is the enrollment rates for students that participated. It's really participate in the emergency financial assistance only component of Stay the Course. And so they were at about 50%, but with the relevant comparison group was only a little bit lower than that. So the difference between the treatment group and comparison group for the emergency financial assistance part of the study is quite small when looking at enrollment rates. And on the right, if you look at degree completion rates, the fraction that have earned an associate's degree, you actually see that the comparison group has received a degree at a slightly higher rate than the group that was invited to have access to emergency financial assistance. Together, what these results indicate is that we're not really getting much bite on offering emergency financial assistance in terms of either increased enrollment rates or increased degree attainment. The kind of early takeaway on this is that you can't get the same benefits in terms of better academic outcomes by providing just emergency financial assistance. Rather, emergency financial assistance coupled with the case management services provided by the navigators in the Stay the Course program are really what's moving the needle for this particular group. The results I've shared with you to this point are all for 6 semesters after degree completion, and we've written this up in a longer academic paper that we'd be happy to make available to anybody who's interested. That's available online. We have also recently gotten data on these same study participants 8 semesters afterwards, and so the question is, do the results that we find after 6 semesters persist further on, so 4 years after enrollment? And this is important to consider because one thing you might be concerned about is that what Stay the Course does is just move people to the finish line faster, and the comparison group would eventually catch up. And if that's the case, that's important to know in terms of what is the ultimate cost benefit. Or alternatively, this could have a more sustained effect, and maybe the comparison group never really catches up to the control group. So we looked at the data 8 semesters after initial enrollment, and here's what we find in terms of earned an associate's degree. And so you still see this large pronounced difference between the fraction of those who participate in Stay the Course who have earned an associate's degree as compared to those in the comparison group. So this difference is a little bit smaller than what I showed you before, So there's a little bit of catch up, but overall we still see that the number is much larger for the stay the course participants. When you look at the females on associate degree completion, what we see is that very similar to the results I showed you after 6 semesters. So this really doesn't provide any evidence that the comparison group is catching up. They're just obtaining their degrees 1 year later. So this is really promising evidence that there is this persistent effect of stay the course on the margin of obtaining a associate's degree. Now, this evidence points to the program effectively moving the needle on key outcomes for this vulnerable population. But an important question that one wants to ask when doing a more broad assessment of this program and the appropriateness of scaling it up and replicating it elsewhere is the question of, is this investment worth it? So we're getting what appears to be a high return, but this is also admittedly a more expensive program. And so the question is the return high enough to justify the additional investment? And so what we did is conduct a cost-benefit analysis to compare the costs of providing these services to the long-run benefits that one would expect to receive from the improvement in outcomes. So let me make a couple of comments about this cost-benefit. So Catholic Charities Fort Worth provided a lot of information on how much it costs for them to provide this program, at least for this initial cohort. The providing all of the services, the emergency financial assistance, the cost of the navigators, the cost of the management and supervision of those navigators, when averaged out across the students in the program, it was about $1,900 a year per student. So if thinking about a student who receives services over the course of 3 years in the program, it's about $5,600. And then the question becomes, is it worth it to invest $5,600 per student over 3 years in order to get the increase in associate degree attainment that we're finding? And so what we did to answer that question is we looked at national data on what is the returns to getting an associate's degree as compared to attending community college but not getting an associate's degree. And so you can think about this as how much of an earnings boost does a participant in stay the course expect to have if they are to complete their associate's degree. And what those data show is that on average, there's an earnings boost of about $1,300 per year. And so you can think about this as the economic gains from you're obtaining an associate's degree as a result of participating in this program. And at those numbers, what this indicates is that within 5 years, so at about 4.25 years, we've already obtained an increase in earnings that fully offsets the investment in the program. So the break even would occur at about 4.25 years of being in the workforce after completing your degree. And this is pretty promising on a cost benefit side, because keep in mind that this is the only metric on the benefit side we're using is the increase in earnings. There are many other benefits one might expect to obtain from obtaining an associate's degree. Those include, Corinne showed you some numbers earlier about lower unemployment rates, so higher employment stability, also higher rates of attendance at four-year colleges. Eventually, this leads to greater educational attainment at the bachelor's level, etc. There might be many other benefits that we're not measuring, but looking at earnings alone, we show that over a reasonable time frame, the participants in this program are benefiting from earnings boosts that more than offset the cost of the program. So that's kind of a quick summary of the results. I look forward to answering any kind of questions that people might have. But before I kind of turn it over to the Q&A, I wanted to talk a little bit about, from our perspective, following up on some of the comments that Corinne made about what it's like to be enrolling and launching a program that has a randomized controlled trial evaluation attached to it. And one of some of the points that I wanted to hit on were, well, how do you manage these results with key stakeholders? And so I've kind of really separated these comments into two groups. One is the internal stakeholders. So this is the staff overseeing the program and the leadership of the agency that have to communicate what's going on, both in terms of the program and in terms of the findings. And then I want to talk about some external stakeholders like fundraisers, funders and foundations and benefactors. So when thinking about it internally, an important concern anytime you have an impact evaluation is that staff can get apprehensive about the fact that this program is being put under the microscope, and oftentimes can be viewed as a high stakes assessment, and that if the program isn't shown to work, that means, or if the results aren't what they hoped to be, that means that the resources might be allocated away from the program. And we work quite a bit to try and communicate these results in a way that it's not a high stakes assessment. Really, what we view this as is an opportunity to learn what works, what doesn't work, and for what groups does the program work, which provides the staff an opportunity, and the leadership of the agency, an opportunity to really learn about how to effectively allocate their resources in an efficient way so that they can really drive improvements in the outcomes for the clients that they are targeting to serve. And so really we think of this as an opportunity for continuous learning and improvement of their program. And just to give an example of that, when we early on, when we were evaluating this, I showed in my timeline that we had results at 2 semesters, 4 semesters, and 6 semesters after enrollment. So after those 2 semester results, we had really promising evidence that much higher enrollment rates for the treatment group than the control group. But then when we looked beyond 2 semesters, the results, enrollment rates for the control group started to move towards those of the treatment group. In other words, the impact of the program diminished a fair amount. And we talked with the program staff about this and presented these results, not as necessarily the program isn't working, but let's explore what's changed, what has happened after 2 semesters as compared to 4 semesters. And this really fostered a healthy conversation within the agency about exploring their case notes and other information they had gathered on the implementation of the program. And one of the things that they uncovered was significant less engagement between the student participants and their navigators over time. And this led to a redesign in many respects, or just kind of at least a setting of some hard targets on the engagement level between the case managers, those navigators, and the students. And we're still trying to kind of tease out what are the factors that are leading to the improvement in outcomes within the program, but it does appear that this engagement does seem to have play an important role. So I view that as an important lesson and a takeaway from this opportunity to get evidence along the way of the impact of the program. I also want to kind of build off a point that Corinne made earlier about the interest that external stakeholders have in this evidence. And there is a bit of a management challenge here as well, because when you have an external funder who knows that you're running an impact evaluation like this, they want to see, or they're asking about results all the time. A program like this where you need students to obtain, ultimately you want students to obtain an associate's degree. You want to look at least 2 years after enrollment before you really start to put too much stake in the evidence that you're finding. But we have found that the message of communicating the stories and frontline experience that the folks at Catholic Charities Fort Worth can communicate along with the evidence, the hard evidence of the impact of the program, has resonated tremendously with these external stakeholders. After about a year into the program, I went down to Fort Worth and presented the early findings together with the Catholic Charities Fort Worth team to a large group of foundations and stakeholders. And one of the results of those meetings was a foundation that had significant interest in expanding this and made the investment to scale up the program so that we could continue to follow these students and to expand the program to an additional campus at Tarrant County College. And so we really feel like that it strengthens the story that you can tell if you have this kind of solid evidence to back up the stories of the impact of the program. And so the question might be, well, where do we go from here? And this program really from the beginning was designed not just to be a program for Tarrant County College. Catholic Charities Fort Worth has thought a bit about how they want to scale this program up. We started with a program in a very local community. So it was launched in Tarrant County College, or in Tarrant County, at Tarrant County College. But the design was to use the information and the lessons learned here to scale this up to programs all across the country. So I'll just briefly mention that Catholic Charities Fort Worth has launched an initiative to replicate this program in communities across the country. And they have, they recently launched an RFP. They've received all the applications for 2018, but let me just talk a little bit about the replication plans for Stay the Course. Over the next 4 years, they'd love to launch Stay the Course in up to 6 sites, and their plan is to do 1 site in 2018. And they've worked a lot on preserving the fidelity of this program. So they've collected a lot of materials and refined this model so that when it's replicated, we know that the program that's implemented elsewhere is essentially the same Stay the Course program as is being implemented in Fort Worth, Texas. And they've provided a lot of materials, put together a lot of materials to make this possible. And one of the things they've done is put together a series of materials that you can navigate through via a website so that it facilitates the getting an external agency up to speed for how to implement Stay the Course in their local community. But beyond that, Catholic Charities Fort Worth has put together a program of technical assistance and training to help agencies get up to speed on how to implement this program. And when the program is launched in these other sites, there'll be a fair amount of quality assurance and monitoring to make sure that the program is being implemented in the way it was designed, and provide opportunities for when obstacles arise that the program can be amended to address those issues. Because not every community is going to have different issues. The issues that students encounter in Fort Worth, Texas may not be the same issues that are encountered elsewhere. So there's an understanding that the program may be modified in other communities. And in each of these cases where we're replicating at a different site, we are working to incorporate the impact evaluation so that we can continue to monitor and assess the effects of this program to verify that the promising evidence that we're finding in Tarrant County College can be found elsewhere. And with that, let me turn it over to you all and so I'll ask for questions. And so it looks like we have a number of questions, and I can't promise we'll get through all of them, but I'll take them I'll try and take them in order. And let me start with the first question from Anupa Fabian. What did the communication between the service providers, research, and evaluation unit within Catholic Charities and LEO look like? Was there a key point of contact in a research evaluation role in Catholic Charities who served as a liaison between LEO and the service providers? Corinne, do you want to, because I'm happy to describe that, but maybe since we have you on the line as well, you want to talk about it from your perspective?
Sure. So when Stay the Course first launched in 2013, there was not a sort of dedicated role to focus on that, sort of bridging the gap between the service providers and the researchers. However, we learned sort of quickly that the program manager didn't have the capacity to be able to do that and to focus on the intervention at the same time. And so we simultaneously had launched a separate project, also in collaboration with Leo. And actually, I myself was brought on to serve in that role for this other project called the Padua Pilot. And we quickly learned that that really did help. It allowed the service providers to focus on the services, and it allowed kind of me and my team in our role to focus on the data sharing components and the randomization and just the kind of research relationship and language. And we found that really beneficial. So we ended up adding a role for Stay the Course that was serving in the same function. And I don't know about you, Jim, but I think overall it's really kind of helped us to stay on track from a service provision standpoint, but also to really build up a great relationship between the practitioners and the researchers.
Yes, I agree. And I think it's really helpful to have someone at the agency whose job is not to, besides the person running the program, who can facilitate the communications between the researchers and and those implementing the program. And so Corinne actually serves that role, takes the lead on that role for Catholic Charities Fort Worth, and that has certainly helped in terms of not just making sure that the information we're conveying gets to the right folks at Catholic Charities Fort Worth, but also that it's conveyed in a way that doesn't increase apprehension or that they understand the results in the context which is appropriate. So just in the interest of time, let me move on to another question was this intervention already established, showing fidelity or before it was rigorously evaluated? This was actually a brand new program designed by Catholic Charities Fort Worth in collaboration with Leo. But it really is based on a lot of information and research that was done on existing programs across the country, and also based on kind of a needs assessment that Catholic Charities Fort Worth had done at the time. I will say that there are there are similar programs out there across the country. The ASAP program is one that also has been evaluated that shows promising results as well. But also our concerns about it being a new program. One thing that we did to address that was to when we launched it at a new campus, we saw that as kind of the phase 2 evaluation. We incorporated some lessons learned, and we're now tracking those outcomes over time. So we look forward to seeing whether or not the same promising results are evident as we have expanded the program and incorporated lessons learned. Another question by Stephanie Lynn was, I'm curious whether participants had input on the study, and if so, how was it sought and integrated? How are results being communicated back to study participants? So I'll make a general statement, and Corinne, maybe you can comment on whether or not information is being communicated to those who are actually enrolled in Stay the Course. But there's been very little after enrollment, very little interaction with the control group. Although they're aware that this program is launched on campus. And I will say that we also have had a qualitative researcher on this project who have observed navigator-student interactions and also done an assessment on kind of from her perspective and based on interviews of students and interviews of the program managers, what appears to be working and what is not working. And that information we provide kind of like a continuous feedback loop with the provider so that they can learn from that information as well as just the quantitative results. Corinne, do you want to add anything?
Sure. So we haven't gone as far as to do a participatory action model, but we do seek feedback from students, as we're able to, particularly if they decide to leave the program before they've completed their degree. We'll ask them to complete an exit interview, and they have the option to do that with somebody besides their case manager or navigator if they choose. And then, as Jim mentioned, in between sort of different cohorts, we've made some slight modifications to the program over time. And whenever we do that, we make sure that we're getting feedback from students to help inform that. But again, the feedback loop is more informal than formal. So when we do receive results and things like that, there are some students who will sometimes be asked to participate in panels or events with some of our stakeholders at a completely voluntary basis. And so if they're a part of that, they'll typically hear about the program at large. But it's not, again, a terribly formal feedback loop with the students themselves.
Great. So I'm really excited about the number of questions. So I'm going to apologize in advance that we won't be able to get to all of them. I will say that if you want to follow up, feel free to. We'll give you some contact information at the end, and you can provide those questions, and we can follow up offline. But Peter Samuelson asks, do you need to get permission to collect data on control group members? So I guess the short answer is no. The FERPA legislation that provides the guidelines for the sharing of student level information has an exemption for research purposes. We at the research team never sees the actual student IDs. They are linked externally to this outcome by the community college. So we get information about the control group without knowing who the actual students are specifically. There are some limitations with whether or not we can share this information or link this information to other external sources. So for example, we're planning to link these data to information on earnings, and so, pardon me, one of the ways that we have addressed the concerns about linking information for the control group is in subsequent cohorts, we have asked the students who participate in the study to complete an enrollment process before we enroll them in the program. And in that case, all of the students are consenting not only to be part of the program and part of the study, but that their information would be linked to administrative sources. Let me do one more question is there evidence of deferred earnings for stay the course participants while they are in school? If so, how large is that cost? So that's from Bill Sermons. We don't have evidence on that right now. Catholic Charities Fort Worth might have some information on amongst their participants, but what I can tell you is that we will be able to answer this question. I think it's really important. The idea is that there's an additional cost of going to community college because you can't work perhaps as much while you are in school. I will say that a large fraction of our study participants are working outside of going to school. And but in the future, when we link to administrative data on earnings, we'll be able to go back and answer that question as what is the earnings loss while you are in school. And with that, I'm going to turn it over to Andrea to wrap things up.
As we come up on time, I would like to thank Jim Sullivan and Corinne Weaver for joining us to share with the Leo community their experience on conducting an impact evaluation and the results on the Stay the Course study. This has been a great discussion. As Leo works to build evidence-based solutions to poverty, having someone, especially like Corinne, share key insights from the process of conducting an impact evaluation with Leo is invaluable. We also want to thank everyone who participated in Leo's webinar on best practices for evaluation today. We will be following up with information about how to access the webinar recording and slides. Finally, if you are interested in partnering with Leo on an evidence-building project, please feel free to reach out to Wendy Bureno, whose contact information is on screen, for an introductory call. If you are interested in opportunities to participate in replication of Stay the Course, you can contact Natalie Jacobs at Catholic Charities Fort Worth, whose contact information is also on screen. We thank you for joining us and hope you have a great rest of the day.